So first, let's start with Suboxone and Subutex. Suboxone and Subutex are both FDA-approved medications for opioid use disorder, MOUDs. The active ingredient in both the drugs is buprenorphine, which is a partial opioid agonist that stops opioid withdrawal symptoms and helps people with opioid addiction. Buprenorphine is the gold standard. It's one of the most effective treatments for opioid use disorder. Now, Suboxone and Subutex are both brand names. Subutex only contains buprenorphine, and it's referred to as a monoproduct. Suboxone is a combination of both buprenorphine and naloxone, and sometimes it's referred to as a dual product or a combination product. So you can see the only difference between Subutex and Suboxone is the presence of the second ingredient, naloxone. And some of you may have already heard of naloxone before. And yeah, it is the opioid blocking medication in Narcan, the rescue nasal spray that's used to reverse opioid overdose. The history of Suboxone, it was released in 2002 when buprenorphine was combined with naloxone, hence Suboxone, as a dual product. Suboxone was marketed as a sublingual drug that was less likely to be misused and diverted, meaning sold or shared and used in a non-prescribed way. When Suboxone is absorbed under the tongue sublingually, naloxone's absorption is minimal, and it shouldn't interfere with the effects of buprenorphine. But if someone were to crush up Suboxone and say inject it intravenously or snort it intranasally, the naloxone is theoretically expected to block the opioid activating effects of buprenorphine, which would discourage misusing Suboxone. So by this logic, Subutex, which does not contain naloxone, is widely believed to be more likely to be misused and diverted. And generally speaking, the medical community, along with legislators and policymakers, hold this to be true. So it's kind of become the standard of care or the default to use Suboxone, except in special circumstances such as pregnancy or people who might have allergic reactions to Suboxone. But typically the answer is yes, if there's a justified, there's a adequate justification. It just means like for me as a provider or any other provider at Bicycle Health, there's a higher burden of proof to justify using a Subutex prescription. And it also depends on the state the patient is in. This means there has to be an established reason to favor Subutex over Suboxone. So for example, if a patient has a severe allergy to naloxone and they can't tolerate Suboxone, then there's a clear reason to favor Subutex. Another example is pregnancy. Though we know that recent studies show that Suboxone is safe in pregnancy, many policymakers, the medical community, and the public continue to believe that Subutex is safer than Suboxone. So actually, pregnancy is often an approved indication for Subutex.